South Africa has made great strides in the fight against HIV and AIDS. The country was reportedly acknowledged by the UNAIDS and others as global and continental leaders in the HIV response. At the recent 7th South African AIDS conference, the Deputy President of South Africa, Mr. Cyril Ramaphosa, said, "We have the right policies in place and the political will to see them implemented." However, he acknowledged further that the scourge of HIV/AIDS is still a massive problem in this country. Mr. Ramaphosa announced a renewal of the country's commitment to the achievement of a generation of under-20s that is largely free of HIV by the year 2030. So today we reflect on HIV/AIDS in South Africa. We have an expert panel of guests from the HSRC, the Presidency, and the TAC to help us unpack all aspects of HIV and AIDS, including successes achieved, current challenges, and more importantly, what can be done to ensure that we achieve a largely HIV-free generation of under-20s by the year 2030. So keep yourself warm, sit back, relax, and learn from this exciting show ahead. And for any questions or views on this topic, please call us on Johannesburg 714-6843, 6847, 6857, or interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk, including our email address, healthtalk@sabc.co.za. I'm Dr. Sello Mutaung, and this is Health Talk.
35 million of the world's population live with HIV. Of this, 6.3 million are South Africans, but 2.7 million people are now on ARV treatment in the post-Mbeki administration. Fewer people are dying from AIDS-related illnesses. Mother-to-child transmissions have decreased significantly, but the high number of new infections among girls is rising.
We have to be very careful that we do not become totally complacent. We're working on an antiretroviral drug that is given in an injection form. We are working on broadly neutralizing antibodies, trying to make these antibodies into an injection so that we can give it to somebody and they can be protected from HIV for several months at a time.
A cure for AIDS is being researched, but a vaccine is a distinct possibility. A trial in Thailand has yielded good results.
I'm very optimistic about us eventually having a vaccine. But the science of making a vaccine is at a very early stage still.
So it is clear that HIV/AIDS is still a massive challenge for this part of the world. We've just seen and heard reaffirmation about the fact that scientists are fervently working at the cure for this disease. Let's understand, with the help of our guests, how far we've come in this fight against HIV/AIDS and where we are now. Now, we welcome our special guests. First up is Professor Jeff Sitswe, or Jeffrey Sitswe, whichever one he prefers. Now, Professor Sitswe is Deputy Executive Director in the HIV/AIDS, STI and TB program at the HSRC, or the Human Science Research Center. Next to him is Dr. Nono Simelela, who's the chairperson of the 7th South African AIDS conference that was held recently, and is advisor to the Deputy President of the Republic of South Africa. And may I just add that she was the first CEO of the South African National AIDS Council, or what we know as SANAC today. And then last but not least, we have Bonginkosi Mthembu. Bonginkosi is from the Treatment Action Campaign, and she's the Skills Development Officer and National Spokesperson in the Office of the General Secretary. Ladies and gentlemen, welcome to Health Talk.
Thank you.
Right.
Thank you.
Perhaps let's start with you. Shall we start with you, Dr. Simelela? We just reported that, we've come a long way with this fight against HIV and AIDS, and we've had some success stories that we can share. Can you perhaps just map out exactly how far we've come with this fight against HIV and AIDS in South Africa?
No, thank you very much. I think there is huge acknowledgement that South Africa started its program pretty slowly. In the late 1990s, we started a program that was largely an information and education campaign.
Right.
There was no treatment then. There were no drugs to provide to people who were HIV infected. We started the rollout with giving mothers who were pregnant medication to stop the virus from infecting their babies. And then we moved on to a much larger program where people who are HIV infected were now provided with medication. From being a country that had a very traumatic and turbulent response, we have now become a country that's got probably the largest number of people on treatment at just over 3 million. In the beginning, mother-to-child transmission was at the level of 30% or even more. We are now at about 2.7, 2.5%, which means that we really reduced the chances of the virus being transmitted from a pregnant mother to her unborn baby. There's a lot more also that is happening in other areas, which is we've now know from the science that if men and young boys are circumcised, they stand a 60% chance of not contracting HIV from their partners. So it's a massive, massive shift from where we were in the 2000s to where we are now. But much more needs to be done.
Okay.
Obviously.
Professor, I mean, we celebrate successes, notwithstanding the fact that there's obviously problems.
Sure.
But what is it that we've been doing right so far for us to achieve these successes that Dr. Simelela has outlined?
As Dr. Simelela indicated earlier on, we started badly because there was no treatment, there was no vaccine, there was, we were doing the best that we could at the time. But the challenge was that we were fighting with one another earlier on in the epidemic. Right. There was a fight between civil society and government because they expected a lot from government, and there was a fight between researchers and others. But I think from around 2007, when we started having SANAC and coordination and started working together, we were able to focus on fighting the epidemic. The truth of the matter is that South Africa has got some of the best researchers on HIV/AIDS. We've got good policies, which means that our policy makers are working very hard to ensure that the research that is being produced is being turned into policies. And we now also have got good programs because now we have the largest antiretroviral treatment program in the world. And so we come a long way. It's because at the time when the epidemic came up to us, we were not ready. We thought that we would get a vaccine very quickly and get a cure and sort it out. But we realized that it might take many more years to get a cure. But we have medicines that work, and we are now implementing, interacting between research and policies and programs in this country.
Okay, we'll come back to research and talk about a lot more about vaccines and so on a bit later. But let's just get the perspective of Treatment Action Campaign. I know that there's problems, and we're going to spend the rest of this program talking about the problems. But let's just look at what it is that we've done right so far, in your perspective.
Yeah, what I can say we did right on the past few years that we were working together with the government and also with the change of the national administration. And then now we've got a good health minister of the National Minister of Health, who's hands-on actually, and then also the policies which are there, and then also he has like an open door policy. Whenever we've got like challenges, we know that we can go to his office and address such policies instead of us being on the street or also taking the government to court. And then working together with the Department of Health did put us to where we are today. Hence we are saying we've got over 3 million people who are on antiretrovirals. And then if ever we still like those previous administration at the Department of Health, I don't think we should have been where we are today, because of like way back then a lot of people were dying every day. There was no treatment, and then we had to force the government to provide antirevirals to people who are living with HIV and AIDS. But like if ever we had like the administration which we are currently having, maybe a lot of lives should have been saved by now. People a lot of people, maybe the life expectancy should have been prolonged, and then a lot of people should have not died.
All right. Okay. Now let's move on to the current scenario. Dr. Simelela, I introduced you as the chairperson of the recent National AIDS Conference. Can you perhaps just take us through the main outcomes of this conference?
Yes, the conference, the theme was reflection, which meant we had to go back to the areas that my colleagues have mentioned. Where did we not do the right things? And what can we learn? Because, you know, history is good if it teaches us what not to do in the future. We looked at refocusing, which means now we were looking at the current programs. What's not working? What are the challenges? And we know that with the number of people that are already being provided treatment, 3 million odd is a huge number. And if you think about the fact that there's more South Africans who are not living with HIV, who need care, the health systems issues become a challenge.
Yeah, but what are the main challenges currently?
Well, it's the fact that people are still experiencing long waiting times at the clinics. Sometimes they do go and find that maybe some of the drugs they need are not available. There are measures in place that are not in every province yet. You know, the challenges, some provinces are stronger, others are more rural. So those are some of the challenges. And then also to be on lifelong treatment. We can't vouch for the fact that we can tell you where each and every one of those 3 million odd people are. So we need a system that can allow us to track people so that we are able to follow them up.
All right, we'll touch a little more on that. Okay, so June is Youth Month in South Africa. So after the break, we take a look at HIV/AIDS and the youth. Please stay with us.
Better route. Incoming. Watch out. Let's brighten it up a little. I can handle this. Engineered intuition. The new Audi A6.
HIV infection figures on the rise in the country among young girls. A lack of adequate information and protection tools are cited as some of the contributing factors. To help counter this, civil society groups want condoms in schools. Government and AIDS lobby groups are already at loggerheads on the matter. The government's draft policy proposes a comprehensive healthcare service at schools administered by healthcare workers.
So the problem is the airplane is good, but I don't see on how possible is it for them to implement. The possible and simple way that we are saying as treatment action campaign, that we are saying with courses, that we are saying with the number of students, is that they just need condoms in the toilet to go hand in glove with comprehensive sex education.
So our view certainly is we need to do something different for adolescents. Whatever it is that we've been doing, not talking to young people about sex doesn't help. We need to look at innovative ways in which we can address the scourge of HIV amongst young people.
This situation is seemingly worse in some other African countries. Uganda, once a model in the fight against AIDS, this subject is not even entertained.
When it gets into education on condom use or even further providing condoms in my own country, Uganda, that is a no-go area.
The delegates warned that if governments are not focusing on primary tools to fight AIDS, they risk to reverse all the gains made thus far.
So central to the fight against HIV and AIDS is, of course, the youth. And if we're ever to achieve that largely HIV-free under-20s generation by 2030, it is hardly difficult, therefore, to imagine that a great focus should be on the youth, and especially young females between the ages of 15 and 24. So, Let us look then at how the youth have responded to the problem of HIV and, in fact, what the youth can do. Okay, let's start with you, Professor Sitso. Professor Sitso, we learned that there was a recent HSRC study that was conducted amongst college students that revealed some very disturbing effects. Do you want to perhaps just take us through that?
Yeah, this study was done among students who are at technical and vocational educational colleges, what we used to call FET colleges.
Right.
And we did the study on all 50 TVET colleges in South Africa. The key findings are that there are positives in the study, that the knowledge levels about HIV/AIDS are quite high, attitude towards people living with HIV/AIDS and people who are lesbians, bisexual, LGBTI are positive, and there are certain behaviors like the self-reported male circumcision is quite high. What is worrying is the level of condom use. It's still low at 55%. And the condom use with different partners, including with a sex worker, was quite low in that study. And there was also a problem with alcohol use. Alcohol use is very high among students in that age group. They are in the age group between 15 and 24, majority of them. In fact, 88% of the participants are between 18 and above. So we're worried about the condom use, we're worried about alcohol use. There was also an issue of about 10% of students and 27% of staff who said they have not heard about HIV/AIDS. We know
in fact, just on that, I mean, when you started off, you said that the one positive thing was that the level of knowledge had increased. But in fact, media reports suggest otherwise, that in fact, it appears that there are people, more and more people, who don't know about HIV/AIDS. What is the true state of affairs?
The true state of affairs is that there are different levels of knowledge that we measure. We measure your knowledge of whether you understand how HIV gets transmitted, whether you know that there is a medication to treat HIV/AIDS, whether you know whether HIV/AIDS can be cured or not cured. So when you get about 10% of people say, we think HIV/AIDS can be cured, you get alarmed. But 90% of the people know that HIV/AIDS cannot be cured at this point in time. But you also want to put up interventions for those people who are not using condoms, for those people who are taking alcohol and are putting themselves at risk, and those people who still think AIDS can be cured, to put interventions to correct that knowledge levels. Yeah.
Bongikos, you know, we're focusing here on perhaps, if you like, risky behavior amongst youth that tends to promote easy transmission of the disease. Now, one of the issues that were mentioned there is the declining use of condoms. How, in your view, is this problem, why are we having this problem in the first place, and what can be done, do you think, to kind of, increase usage of condoms?
Okay, what I can say is that we need to have sex education in school, and also one of the things which we are advocating for as treatment action campaigns that condoms should be provided in schools, because of at the end there's all the especially in Gauteng there was a high number of teenage pregnancies among school going girls. So what we are saying is that condoms should be available in schools, and then also learners, they must be educated on how to use condom correctly and consistently. And one other thing, we know that in our country there's a high unemployment rate, and then so a lot of young boys and girls, they then engage into intergenerational relationships so that they can get money to buy food or get money for lunch at school. And then if ever I'm an adult and dating and sleeping with a 15-year-old girl, I will say, we don't have to use condom because I'm giving you money. If ever you want condom, I'm not going to give you that 100 rand.
So we'll get back to that issue of condoms, because I want to know whether the problem is that the condoms are not provided, or that they are provided and that they're not used. But in the meantime, we have Mpo on the line from Pretoria. Hello, Mpo.
Hello, sir. How are you?
I'm good. How are you? Your question or comment, please?
My question, I have a question and a comment. The first thing is the comment. Putting condoms in schools is not the right way to go, according to me. It's like encouraging them to go ahead and have sex, whereas we're supposed to encourage abstaining and waiting to get married when you're over 21. You know, to me, it contradicts with that. And my question is, how often do people go to these schools? I'm talking about from middle schools, because I've seen lots of children here in Hammarskraal. There are so many that are pregnant. Do nurses go to the schools?
Okay.
Is there anybody,
All right.
following up on what is happening regarding sexual education in the schools?
All right. Thank you very much, Mpho, for your contribution
so much.
and your question. Let's give it to Dr. Simelela.
Yes.
Firstly, she mentioned the issue of the condoms and I don't think she's the only one that believes that, providing condoms apparently is supposed to be encouraging sexual activity in young children.
I think what is important for South Africans to realize is that, HIV it's not a medical problem. It's a societal problem.
Right.
It's our responsibility as parents, as leaders, as people as adults, to educate our children. There is a lot of research that has been done in many countries, in Europe in particular, in the Americas, where providing young people with education, information, and the tools to protect themselves has shown that does not promote sexual activity.
Okay.
So we base that on that research. And it's important. I mean, the lady who phoned in says, the young people are pregnant, which means already they're having sex. So it's actually contradictory.
Right.
So we need to provide the tools.
And her second question about people visiting schools?
Yes, there are nurses that visit schools. There is an integrated school health program where they do go to schools to do the work that they need to do. Yes.
Okay.
Yeah, just to indicate that part of the national health insurance is to ramp up the school health services so that the services that are provided for young people are integrated, so that we don't only narrow this thing towards providing condoms in schools only. There's also other interventions that we can do, providing education, encouraging people to delay sex, and ensuring that people understand the tools that are available to them and use them appropriately.
The other problem that Bonginkosi mentioned was that of intergenerational sex. I mean, this is a huge problem, and perhaps it goes back to that problem amongst college students, that sometimes you hear stories about these young girls not affording tuition fees and subjecting themselves to sexual activity with older men with the view of getting money. How can we sort this problem out?
Initially, it started out as what you call sugar daddies, which was men over the age of 50 becoming a bigger phenomenon. We are now seeing another phenomenon of actually younger men who are economically strong, who are getting good jobs, and who are in the ages between 30 and 45, for example, who are now going out with younger women between 15 and 24. Now, you may not call them sugar daddies, but these are the young guys who are they've got money and they can buy sex, and as Bonginkosi indicated, there is less opportunity for protection in that case. I think we need to do targeted interventions to all these groups, not leave out men in the interventions, and making them aware that it's important for them to protect themselves and to protect other people.
I wanted to just hold you there because we have Ratu on the line from Nelspruit. We'll just take your question and go for a quick break and answer a question after the break. Ratu, hello?
Yes, hello, how are you, sir?
I'm good, how are you?
I'm fine. Sir, I'm just having a problem here because I want to know the condoms that we get from clinics and the condoms that we buy, especially from the pharmacy, are they having a detrimental effect, especially the ones from the clinics? Because there's a problem that sometimes you find that you develop some source from the main food. So I just want to know what is the implications of those condoms in terms of safety.
In terms of safety. All right. Thank you very much for your question. We'll answer your question after the break. Please stay with us, because after the break, we look at the question of stigma and HIV and AIDS, and we'll try and answer those questions. Stay with us.
This is Apiwe Tamela. She's 25 years old. Apiwe discovered she was HIV positive when she was 3 months pregnant with her daughter, Sipogazi.
My grandmother asked me to go at the clinic, and then I'm going there, and then told me that my status say I'm HIV positive. Oh, I was so shocked. Like, I feel like I can cry. Like, if I'm crying, this thing is not going to go somewhere. It's in my body, so I must accept it.
There is a 25 to 30% risk that babies can contract HIV from their HIV positive mothers when in the womb, during delivery or during breastfeeding. Following the prevention of mother-to-child transmission guidelines can reduce this risk to below 5%. Because Apiwe found out her status, she was able to take the necessary steps to try and ensure that Sipogazi remained HIV negative.
When I received my baby, the clinic told me that my baby is negative, and then told me that after 6 months I must come back and check my baby is not positive.
Apiwe was put on a course of antiretroviral therapy to last the duration of breastfeeding. Baby Sipogazi was given 1 drop of nevirapine syrup, an antiretroviral, for the first 6 months of her life. Thanks to their adherence to the 6-month treatment program, Sipogazi remained HIV negative.
My baby comes first. So anything can happen. I will fight for my baby because I love my baby so much.
Being a young HIV positive mother has made Apiwe think about the HIV education she will one day give Sipogazi.
One day, if my daughter is growing up, I will teach her about condoms.
Apiwe has accepted that she is HIV positive, but in her community, some people still have a negative stigma towards HIV.
There are many people talking. You see Apiwe, it's sick, it's going to die. How do you know? I know it's HIV positive, you see, those things. So every day or some days I hear those things.
People still have that concept that HIV is a death sentence. Once you have HIV, you're going to die. There's nothing that you can do after that. People are still very scared of HIV. So much that it has acted as a barrier as to some other young people coming out with their status.
Apiwe volunteers at this local park in her neighborhood. Along with a group of fellow residents, she picks up litter, helping to make the park cleaner and safer. She also uses this opportunity to speak openly about her HIV status.
If ndivula isifuba sami, ndibapha amandla. Because abanye abantu mhlambe umuntu ebeyazi ngale nto le qha ebeyifihlile ibiphakathi kuye emzimbeni. So like engakwazi ukuthi like angafumana umuntu angathetha naye. Like mnane umuntu like ebengane uyicinga lento ukuthi like ngingathetha no Apiwe nge-status sam.
It would be great if we had more young people actually who are totally out in the open about their status and actually doing something in their communities to make a difference.
Ungcono ba ndivule isifuba sami kwenzela ukuthi mhlambe ngizofumana more friends or more abantu abafuna ukwazi ngolwazi ukuthi ingculaza yintoni, ikuphatha kanjani, ungaba yintoni, unalento le.
Apiwe has also started offering her services as a hairdresser to the community. At the moment, she operates from home, but she has bigger plans for the future. For Apiwe, life does not end with HIV.
Just don't look back, look forward.
That's the story of Apiwe. See, Apiwe talks openly and freely about her status and that of her baby because she's not hindered by stigma. In simple terms, stigma is defined as the shame or disgrace attached to something regarded as socially unacceptable. Now, HIV-related stigma affects people differently and can make the fight against HIV more difficult than it should be. Now, we're going to learn more from our guests about stigma, but before that, we had Rato on the line from Nelspruit, I think it was, who asked a question around condoms. And if I understood him correctly, it was around the safety and quality of condoms and whether or not there's differences between those that you find at the clinics and those that you find at the pharmacies. Can I put it to you, Prof?
Yeah, the condoms that are used in South Africa are of good quality. Whether they are choice condoms or whether they are labeled condoms that come from the pharmacists. The condoms are tested by the South African Bureau of Standards for quality. And more recently, when people were complaining that the condoms could have a smell that was that they did not like, the Minister of Health launched colored and flavored condoms at universities, and so there are colored and flavored condoms, if you wish. So there are choices for people to use on condoms, but the quality is acceptable.
All sorts of condoms available from anywhere in South Africa, and all of them are of good quality.
You just check them. If you see the SABC label, you know that it's tested and it's of good quality.
All right. Now, Dr. Smilela, let's talk a little bit about stigma. I mean, this is a huge problem. Recently, we had this National Stigma Index survey that was apparently launched at the conference as well. Do you want to perhaps take us through that?
Yes, this was the first time that South Africa did a study that looked amongst people who are living with HIV, how they experienced stigma. There's two ways that this was done. How they feel themselves, which they call internal stigma, because somebody would think because I'm positive, then this is how people are perceiving me. And we found that there were still quite a significant number of people who felt that they couldn't step out there and be themselves because they think people will discriminate. And then stigma that is meted out by other people who feel that those who are HIV positive must be ostracized. And we found that, there are still pockets of stigma in the country. Surprisingly, there's also stigma towards people with tuberculosis, which is quite a surprise for us.
Yeah. It's a new one, isn't it?
It's a new one, and it's a worry because we've got quite high levels of both co-infection between TB and HIV. But I must say that with the expansion of the programs, it's really less. I think people, with more people living openly, with more people speaking out, with people knowing that something can be done, we can continue to push back on the issues of stigma. We know that our constitution does not allow discrimination, even in the workplace, so we do have the tools, and platforms like the program that you've provided to us today should help us also to continue to disseminate this information, that we must embrace everyone, and that it's possible to live and to live fully with HIV.
All right. Let's get the TAC's perspective perhaps on the stigma issue.
Yeah, stigma is still there, and hence Dr. Nono Smelela talked about internal stigma. The thing is that a lot of people, they still don't accept themselves as people who are living with HIV and AIDS. So if ever I haven't accepted my HIV positive status, and then how can the community, how can my family accept me? Because everything, it starts with you. If ever I do accept myself that I'm living with HIV, and then when I come out to disclose to my family or to my friends, and then I expect them to accept me because already I have accepted myself. And then one other thing, when I first find out that I was living with HIV, and when I first found out that I was living with HIV, I told myself I do have to accept that I'm living with HIV, and then HIV is not going to stop me from achieving my goals. HIV is not going to stop me from living my life. And then from there, when I started disclosing, and then it was easier for my family to accept me because already I did accept myself. So if ever you stigmatize yourself, and then obviously whenever you walk around the street, you will feel as if like you are being stigmatized or you are being discriminated because like you didn't accept yourself. So what other people need to do is that like you have to accept your status and then go out there and speak openly about HIV, because of like now we've got treatment which is there that does lower the amount of the virus in your blood. So you mustn't be ashamed because of your HIV positive status. And then why must I be ashamed of? Because of like HIV is one of chronic illnesses now, because there's treatment which is there. So if and it's easier again to live with HIV than living with diabetes, because of like you have to inject yourself every day. But like with HIV, you take like your antiretrovirals and then your viral load. If ever you adhere, and then your viral load will be suppressed. And so there's nothing wrong with a person who is living with HIV and AIDS. So what we need to do is that we need to go out there and educate people who are living with HIV and AIDS that like there is nothing wrong. You mustn't be ashamed because of like you didn't go out there and look for HIV. HIV came to you and then it is in your blood, and you can't tell if ever someone is living with HIV or not. But like because of like the stigma which we internalize ourselves, and then that's why whenever you go around the street, we say like everyone can see that like you are living with HIV and AIDS.
Okay. Prof, you know, of course we've heard about, you know, the stigma issue, internalized versus external stigma. Let's just try and understand the risk factors, or put differently, who's more likely to have internalized stigma and who's more likely to have externalized stigma, as it were, so that at least if we know that, we're able to then, you know, focus our attention on, you know, where it's supposed to be.
If you are worried that there's a support structure for you, family and people who are close to you, that they may not support you, you find it difficult to disclose your status, and therefore it's difficult to accept yourself, as Bonyekos was indicating. So it's important for members of the community to remain support structures. Your brother with AIDS is still your brother. Your sister with AIDS is still your sister. So it's important for members of the community to understand that HIV/AIDS is not a death sentence, that it is one of the chronic illnesses, that there's treatment, and life expectancy actually has increased. And so once people understand that HIV/AIDS is not a death sentence, that your brother remains your brother and your sister remains your sister, we'll see a lot more people disclosing their HIV status and a lot more people not having internalized stigma.
And more education to people to get rid of these prejudices and myths around HIV/AIDS.
True, and to share the positive news that the life expectancy has increased from 56 to 61 in South Africa, and that medicines are there, and people are going back to work, people are living their life. They are going to live as long as they were going to live after taking medications.
All right, I believe we have Vuyo on the line from NRL. Good morning, Vuyo. Vuyo, are you there? Okay, it appears Vuyo is lost, and we'll try and get him back on the line. Dr. Simelela, I'd like to give you an opportunity to say your last word on the stigma, but unfortunately we have to go for a break. So the question is then, what should be done to ensure that we win the battle against HIV and AIDS? We'll find out after the break. Please stay with us.
Welcome to Network, a technology news program that also discusses what's trending in social media in and around Africa. MTN has launched its new movie and television streaming service, Front Row. If it's trending, we will find it. That's Network with me, Siphumelele Zondi, every Sunday at 7:30 p.m. only on the SABC News Channel.
Welcome back. Now, the fight against the scourge of HIV/AIDS is not only government's responsibility. Who else is required to join, and what role can you, the viewer, play in assisting in this battle? Let's find out from our guests and get a bit of advice. Let's start with Prof. Sitso. Or perhaps before I get to you, my apologies, let's start with the presidency now. Okay. Which are the priority areas for government in this fight against HIV and AIDS?
Our biggest priority is prevention, especially amongst young women and girls between the ages of 15 and 24. That is where we're focusing, and that is where we are calling on the community, the society, to help us with this. It's information, it's empowering young women and girls, and it's also speaking to the young men and the boys out there to take responsibility. It's really important for us to not feel disempowered. You know, as you said earlier on, it is not just government's problem. Here it is, it's a lifestyle issue. If you've got diabetes, you've got to take care of yourself. If you need to eat a healthy food to be able to manage your life, that's what you do. With HIV, anything that you do is safer sex all the time. Consistent condom use.
All right. I believe that we have Vuyo back on the line. Hello, Vuyo. Vuyo, are you there with us?
Yes, I'm here.
All right. Let's have your question or comment, please.
No, actually, I don't have a question. Yes. What I want to say is I'm very happy about the South African government, what he's doing for South Africans, especially who are living with HIV. Yeah. I'm a HCT counselor for quite a long time. I'm very happy about my job, and I'm helping a lot of people. But what my concern is, if the HIV program managers there at the studio, if they can take us in consideration, because our problem is our government are still giving us stipend, of which we are dedicated in our jobs. Thank you.
All right. Thank you very much, Vuyo. Well, let's give it back to you, Dr. Simelela.
Yes.
What support are given to, we've just said now, it's not government's responsibility. We need everybody. It's a team effort. What support is given to people like Vuyo?
Yes, I think Vuyo raises a very important point. What has been done now is that the National Department has asked all provinces to look at the support provided to people who are providing counseling and testing. And a province like KZN, for instance, has now taken them into full employment. We are asking provinces to reconsider, to make sure that they are supported, to make sure that those that have been in the system for a long time are really considered as part and parcel of the health providers in that province and given appropriate remuneration according to the work that they are doing.
Okay. Professor, what is the role of science now? I mean, earlier on we spoke about the fact that we're still working at trying to find a cure for AIDS. Where are we with the vaccine?
I think South Africa is doing very well on research. We have, you have heard Prof. Salim Abdul Karim talking about going further in trying to look, for example, for an injection, an ARV that is in the form of a vaccine. Yeah. We have contributed to research on prevention of mother-to-child transmission. We contributed to research on medications, antiretrovirals that are now we have one pill. We don't have the 15 or so pills that we used to have in 2000 or so. And so the research that is being conducted in South Africa covers a myriad of areas. It's in the biomedical area, in the behaviors, where we are encouraging prevention. We're with government on the issue of prevention, that we need to close the tap on new infections of HIV/AIDS. We need to look at those target groups, particularly young women and girls, and key populations. And key populations, I'm talking about sex workers, and I'm talking about transgender people, people who inject drugs, and prisoners and migrants. We've got a lot of those target groups, and MSM, where we need to make sure that we have targeted interventions for prevention. We need to close the tap so that we don't have new cases coming into the big pot, and to also continue to treat those that are on treatment and ensure that they comply to treatment.
Okay. Dr. Simelela mentioned the notion of prevention, and focusing specifically on the youth now. What can be done to assist the youth in preventing transmission of HIV/AIDS in the first place?
Like in Prevention Campaign, we've got a program where which we call like young boys and girls on the move. We've got like teenagers who go to school and educate their peers about prevention, and also prevention, treatment, care and support on what needs to be done. So in Gauteng, we've already piloted that project, and then already in schools around Ekurhuleni, and also they are also educating like youth which is out of school. So prevention is still a key thing. And then also one other thing which we are doing in Free State, we are focusing on prevention, but like for the LGBTI community, because like they don't have access, they are a key population, and then they don't have access. Even when they go to healthcare facilities, there are no preventative measures for them. Hence, like in the Free State, Eastern Cape and Mpumalanga, our main prevention messages goes to the LGBTI community. So
what do you mean they have no access to facilities? Are they chased away from the facilities?
Yes, they are being discriminated because of their sexual identity. And then like at times, because of like we've got like those lesbian women who present like as if like they are males, they are butch, when they go to clinics and request like female planning or condoms and all those things, or like when they want contraceptive. There was a case in Ritz where a lesbian was turned away saying like, why do you want contraceptive? Why? Because of like you act as if like you are a man. So she was turned away. And also there was a gay man in Velcom who was turned away when he reported for piles and said the healthcare worker said the way you engage into sex is not good, and then it's not a natural way, so we can't give you the treatment which you require. So that's why in those 3 provinces our main focus is that key population, the LGBTQI community.
Okay. Dr. Simelela, I'd like you to comment on that, but perhaps also just going back to the issue of prevention now. We know the notion of the criterion for starting ARVs, that we look at the CD4 count. But there's some people that are coming out to say, maybe we should do away with this CD4 count thing and start people as soon as they're diagnosed with HIV. Your comment on those 2 things, please.
Well, I think it's something that's on the horizon. It's been debated. Very recently, there was a big study that was conducted across the world that the Centers for Disease Control has released that actually says, yes, test and treat. It's not going to be a cheap option, because we as a country have the largest number of people who are HIV positive, but slowly the tide is moving towards that. And we are going to have to look at it as a country. It would be something that has to be discussed from a fiscal point of view, as well as also from the communities as well, because that means lifelong. That means being supported all the time.
Yeah, and the prejudice issue against LGBTs?
No, that is a real issue. It's something that we have to consider and work on. In fact, we're past the issue of consideration. Yeah. Everybody has a right, and we're starting now to train health workers in the clinics to provide condoms, lubricants, and what people need to practice safe sex.
Ladies and gentlemen, thank you so much. It's amazing just how time flies. Professor Jeff Sitzer from the HSRC, Dr. Nono Simelela from the Presidency, Bongenkosi Mtambi from the TAC. Thank you so much for your contribution.
Thank you.
Well, folks, it's on that note that we come to the end of our show today. Your views and comments, again, are extremely valuable to us. Please share these with us on our Facebook page, SABC Health Talk, and like our page. Otherwise, follow us on Twitter, SABC Health Talk, and drop us an email at healthtalk@sabc.co.za. Join us again next week on SABC News, and remember that you can watch repeat shows of this program at 2 p.m. and 10 p.m. Otherwise, if you missed any of the sessions, you can catch that on the YouTube channel. And from myself, Dr. Selom Daung, and the rest of the crew here, it's a very warm goodbye. Thank you so much for watching. Take care.